Welcome, everyone, to another episode of Inside Lyme Podcast with your host, Dr. Daniel Cameron. In tonight's episode, Dr. Cameron will be discussing part 3 in his Lyme disease and COVID-19 survey findings. Dr. Cameron will focus on the case of a 28-year-old woman with a history of Lyme disease who took the COVID-19 vaccine. Good evening, Dr. Cameron. Thank you for taking the time to discuss this case with us.
And thank you, Darlene, for leading the discussion.
Can you tell us a little bit about the case?
Well, this whole case is part of a survey, a COVID and Lyme survey, where it's IRB approved. It's over 1,000 people have finished it. Were kind enough to share what they had experienced. So I'm able to discuss this case. So I wanted to tell you, also anybody who's interested in filling out the survey, this is a way to share your experience with COVID or share your experience with the vaccine. So this case, she was 28 years old. She's a Latino woman with a tick bite and a rash. And she got that while she's on vacation. But as you know, some people are quite sick. So she described not being able to finish her college degree, was unemployed at the time of the survey. And she had a positive IgG Western blot, was treated for Lyme and Bartonella. But she had been sick since she was 16 years old, and now she's 28. So over time, she was treated with various oral medicines, not under my care, but someone else's. Zithromax, vancomycin, Levaquin, and IV ceftriaxone, and a bunch of alternative medicines, including glutathiones, saunas, steam rooms, magnesium. So even though she had been sick since she was 16, now at the age of 28, she still had so many symptoms that anybody with Lyme disease is familiar with. So that's why it's the typical fatigue, the concentration, the neuropsych issues, a lot of mood issues that a lot of patients have, like irritability and depression. The sensory system was up, so she was sensitive to light, noise, and odor. And with that particular thing, here she is in a pandemic, age of 28, sick that many years. And so she goes on and fills out this COVID and Lyme survey and shares her experience with the Pfizer vaccine.
So she decided, despite having her ongoing symptoms, she decided to go ahead, had the Pfizer vaccine in May of 2021. And can you tell us what her response to that vaccine was?
Well, it's always difficult to know how one's going to feel when one takes the vaccine. Sure enough, she got symptoms, and I'll be discussing the findings from the study at another podcast. What happened in that survey is that, just like any survey, is that there's an awful lot of people who get headaches, soreness in her arm, and some fatigue for a day, 2 days, 3 days. And that happened for her, but it's also really common for people who don't have any history of Lyme disease. And in her case, there's a symptom burden score that I was working with from Fowle and Alcott's work. And so it's pretty hard to, on that score, you never get a 120, you never get 0 very often. But her score is 43 out of 120. But that score is really still higher than people who had traumatic brain injury. Lower than people with depression and post-treatment Lyme disease syndrome, but it's still a substantial burden of symptoms. So even though she had the vaccine, she didn't feel that her Lyme disease got worse as a result of the vaccine. She encouraged others to take the vaccine. But when I asked her, what her worst symptoms are, they were not really different than she had before getting the COVID vaccine. Again, she also had all of those symptoms I talked about but she also had felt worse after physical activity. Her bladder was uncomfortable, which often happens as part of like an autonomic nervous system problem. The autonomic things take care of automatic things like blood pressure, and they also take care of the stomach and the bladder. And so she apparently has some autonomic nervous issues by her report, and cognitive neuropsych issues. And so here she is, in summary, a 28-year-old who was able to describe her experience with the vaccine despite having been sick that many years.
So was actually quite sick from Lyme disease and had relatively few symptoms as a result of the vaccine.
But it didn't seem like it changed her symptoms. She elaborated a little more on the symptoms, and so it's helpful to like look past this case. And on the next podcast, I'm going to be discussing the entire study. And on this particular blog post, the study actually had 1,168 individuals who had reported having Lyme disease, and 616, so over half, actually had taken the vaccine at the time of the survey. So even though over half took the vaccine, there is likely others who took the vaccine later. So what I'm going to be discussing at the next podcast is that one would think that the overall score on this burden of symptoms, on the burden of all of these neuropsych issues, you would think it might be worse with the vaccine. It was not worse. Instead, the scores were better after the vaccine. And of course, it's always hard to tell, were the healthiest people taking the vaccine? But it's certainly a nice observation that at least the average score for the average person isn't worse. And on the next podcast, I'm going to get into some specifics, because there are some individuals who do have negative reactions that last more than 3 days, and those reactions are worth exploring.
So I imagine your takeaway to the audience on this is if you do have Lyme disease, and even if those symptoms are fairly significant, the vaccine is not necessarily going to make your symptoms worse.
Yeah, the average certainly doesn't get any worse, but there are still some individuals who do have a reaction that's significant, and it's worth exploring those and trying to understand what happens. Therefore, it's one has to include this kind of information in making a treatment decision, or at least taking a vaccine decision, because there's always concerned with the risk of the vaccine, but we never seem to have the data. So this will help and should help in my practice whenever I discuss the COVID vaccine with them.
Now, I imagine you've also had patients asking about boosters. Have you had to address that concern as well?
Yes, this paper doesn't really discuss it, but there are probably equal number of side effects between the first and the second. But the booster, I really haven't got a chance to run the numbers. It's a work in progress, because this whole survey started in July. And so over time, I'll be able to follow people and get a better sense of if the booster is a problem. It's also important because you're starting to get people who have the vaccine and they get COVID, or they have every combination you can think of. And so it's a growing number of questions that are being raised. And I always encourage people to keep filling out this survey, because Anybody that's coming on now is able to kind of add a little more information about the boosters, as well as just the vaccination problem in general. So I'm looking forward to that data.
Well, we should let everybody know that if they'd like to fill out the survey, or if they'd like to read a little bit more about some of the findings from the survey, they can do that at danielcameronmd.com. Thank you again, Dr. Cameron, for discussing this case, and we look forward to the next podcast, which will discuss further findings.
Thank you, Darlene.